Hey guys, and welcome to today's live stream. We're going to be talking all about a pain in the bum and going down the leg. So hopefully it's going to be really helpful. I know a lot of people with back pain will start off by getting pain in that buttocks area. Sometimes it spreads a little bit to the leg, sometimes it spreads to the back. And hopefully in today's live stream, you're going to understand how to avoid misdiagnosing that, what we need to do to fix it, why sometimes there is that misdiagnosis side of things and why it makes things worse, and what we need to do going forward. So hopefully it's going to be really useful. If you are new to the channel, please do consider subscribing. We do these live streams every single weekday, and we always finish with Q&A. Today we've got Lara the other side of the camera. She's going to be going through your questions, and we will get to the answers to those at the end of the live stream. So if you've got any questions about this, maybe you've got back pain, maybe you don't have back pain, you've just got that buttock pain, then please do post in the comments and we'll do what we can to help you guys. And with that being said, let's get into today's topic. Okay guys, we're going to start off, just a little sort of framework for today's live stream. I'm going to start off by talking a little bit about sort of the region that we're talking about, that buttock region, sort of down here. Maybe it's one side, maybe it's both sides. Either way, we're going to cover that, what's actually there and how does it get injured. A few pet peeves there as well, which I'll talk about, just to make sure you guys really understand and can get in my head so it helps you deal with these things as well as possible. Then we're going to talk about why it gets worse, especially if we're working on some of these misconceptions. And then at the end, what are we going to do to get it better? And obviously the Q&A to finish. So the first thing, what are we talking about when we're talking about that butt pain? It's going to be the gluteal region. It's going to be potentially the piriformis, and I've put in red just on the board behind me a hint that is not the problem. A lot of people get caught up a little bit about the muscular symptoms. It's quite often that we'll go to the GP or the doctor or whoever first, and they'll say, hey, they've got the pain over the buttock. Sometimes people will refer to this as the hip region. That's not particularly helpful from a practitioner point of view, because the hip is obviously the socket rather than the region. So just if you hear, maybe you've mentioned your hip and they start talking about the buttock, that would be why. So just one to bear in mind, commonly this is referred to as the hip as well by patients, when actually we mean the buttocks region. So you go there and they say, okay, look, it's just a muscle problem. Go and do some stretches and you're going to be okay. And it doesn't work. Now, I want to really address the glutes and the piriformis, because those are the ones that are so frequently diagnosed as being, oh, you just need to stretch them out. It's your piriformis, it's your piriformis, it's your piriformis. In order for us to actually injure muscles, first and foremost, we have to have had an extreme stress or strain on those muscles firstly, above and beyond the normal. So many of you, if you've woken up and it's just a little bit sore, or that's when it started, and you didn't do anything notable the previous day, then it's not your piriformis. It's just not. That's not the problem anyway. And the notion that we can injure a muscle that's probably about that big when it's working in and amongst a bunch of other lateral hip rotators in that same region, and then the glutes over the top, the notion that we can manage to somehow isolate that one structure to overload it is really difficult to get your head around. Because if I said, can you please flex your piriformis right now, you're going to look at me probably, or look at the video in quite a weird way. Whereas you can flex your bicep, we can get this bicep to work. We can't do the same thing with our piriformis. It's very difficult to injure these sorts of structures. You'll notice that the pecs and the biceps, very commonly, those are injured where people are overworking them specifically. And that's the scenario where we can injure these muscles. If that's not to say they're not problematic. Your piriformis and the other rotators there might well be problematic. That is definitely a case. But why are they problematic is what we want to understand. And when we look at the neurology up here, we've got the L4, L5 and S1 regions, or the L4-5 and the L5-S1 regions, which are the most commonly injured regions in our lumbar spine. They're the segments of the spine where the L4 vertebra meets the L5 vertebra. We've got the disc in the middle, and then we've got the nerve on the side, as I've drawn on the board on many a live stream. And those nerves control the piriformis, the glutes, the hamstrings, the calves, all the areas that many of you will have experienced symptoms or could potentially experience symptoms. They come from here. And if we have injuries here, we can very conceivably and very often get reactions in these muscles. So it's a case of, we want to understand the problem and the reaction, not the problem and just completely ignore this. So that's really what I want you guys to get in your head. We're not saying that there's not an issue in these regions locally in the buttocks. There's no issue there, but it is a reaction to a problem that often, or all too often, is ignored. Now, I do want to also cover the fact that sometimes this buttock pain can go from one side to the other. It can go back again. It can go a little bit higher, maybe up to the attachment site of the glutes on the what's called the iliac crest, which is where we generally see your waist. It can go down the back of the leg a little bit. It can go down the side of the leg. I don't want you to get too caught up on that. We speak to people in the clinic and we speak to people on the virtual consultation calls and in the membership site, and sometimes people get caught up a little bit on the symptoms. Oh, they changed a little bit, they're here, now they're there. And there's different variations of it. The problem with the back pain is that we can't isolate your back, as we mentioned before, and unfortunately there's a lot of misconceptions, not least what I've just mentioned. So we do the wrong things and we make things worse, and we have flare-ups, and unfortunately when things flare a little bit, they might irritate slightly different structures in that same region, and that may change the perception of pain. That may change where the pain is. It may go down the leg, as I mentioned, or it may move to the other side, especially with disc problems. That is completely possible. That's not to say it's a different issue. And I've got a little hashtag on the side here talking about fractures. You could have a very serious fracture. You could have a minor fracture. We could have a crushed fracture, a hairline fracture in, for example, our arm. But we're still going to need to do the casting and the rehab protocols afterwards in order to get it better. That doesn't really change it. So whether it's just in the buttock or it's in the buttock going down the leg because the L4-5 is injured, you don't want to get too caught up on specifically where it's changing. We want to understand where's the injury. It may be getting slightly better or slightly worse because of things we're doing on a daily basis, but don't get too caught up on the way in which symptoms might change. That I really want you to avoid, because otherwise it can lead you to focusing on so much on this where things are moving around to and not actually sticking to the program and getting things better. So that's a very, very important thing for you to bear in mind. Why does it get worse? The real big one here is that people work all too often on the wrong diagnosis. They're working to try and deal with a muscle problem, and really that in of itself involves the exclusion of a back problem. They exclude the notion that it could be a lumbar spine issue, and all too often we also see that a lot of people with these issues have reduced lumbar curves. And therefore, when we're doing some of the stretches like the classic piriformis stretch or some other glute stretches, we're ignorant or inconsiderate to the fact that there may be a lower back issue there, and we do things that don't help the lower back. So we might be doing posterior pelvic tucks, we might be doing a little bit of a knee hug with that piriformis stretch, the common one being lying on your back, kind of crossing your legs over. Many of you will have done this, and then pulling the knee towards the chest. Well, the impact of that is that it flattens the lumbar spine, even though it gets a nice stretch through the piriformis. And if we believe that the piriformis or glutes are the primary problem and we just need to stretch them, and we're just hell-bent on stretching the living daylights out of these things, then we really are going to push it hard, and that is going to make this work and this worse, and we're going to end up getting stuck in this vicious cycle of I've got so much tightness, I've got to do more stretching, and then I make it worse slowly, and then I feel like I need to get more I've got more tightness, and then I do more stretching. Leave the stretching alone. If you're in the back in shape group and you're going through these processes, and we know we've got a back problem and you're getting that stiffness in the hip region, do the necessary stretches that we tell you guys to do them safely, do them correctly, and work on the strengthening component and doing the other relief-based things. Sometimes these things take a little bit of time to actually go through the healing process, and we need to make sufficient progress with the strengthening in order to protect the lower back so these muscles don't go into spasm and we don't get pain there. And we need to get that momentum there rather than being ever so focused on just stretching these muscles, because they're invariably reacting to overdemand and an issue in the lumbar spine. So that brings me to the last part here. How are we going to fix it? What are we doing? We want to treat it. We want to first get the right diagnosis. It's no good trying to screw a nail in with a hammer. Screw a screw in with a hammer or use a screwdriver on a nail. It's not going to work. We need the right tools. We need the right approach for the right problem. And this is where we've got the back in shape work. We've got those principles. Many of you guys will have seen the phase 1 videos, and I know many of you that watch will be in the phase 2 and phase 3. We want to go through the same process. We want to keep those hips as mobile as they can be. We want to work on decompressing the lumbar spine. And we want to work on providing an engagement, an ability to cognitively engage our core to protect our lumbar spine on a day-to-day basis, and then start strengthening things up through that phase 2 and really getting some solid momentum in what we call phase 3. That is the way we go about doing these things. Now, we had a little question on massage, which is why I've got the question there. Is massage okay? Because quite often we do feel there's a degree of tightness and we want something to be done in that lower back or in that hip or in that the thighs because they're tight and they're sore and they're reactive. And there is absolutely no problem with that. We've got perhaps an L4-5 or an L5-S1 region bombarding that poor muscle with unnecessary over-the-top stimuli, and it's not getting the ability to get rid of some of those waste products, get rid of some of that lactate, and it's building up, and that is also a problem. We have to recommend, and that's why we never say there's no stretching involved, but we need to be sensible with the way in which we're doing it, and we need to understand the problem better. So massage can have a place, but I want to talk very specifically about this because it's really, really important. If you're someone with a lower back issue that's been building up maybe for a longer period of time especially, it needs to be treated in a very different manner to the athlete that's injured themselves, maybe doing triple jump or something like that. Many of you guys aren't at that elite level of athletic performance, and your bodies are not in those conditions because you're not competing at maybe a semi-professional, etc. level. Therefore, the deep massage that individual's body can sustain and can react nicely to keep them mobile and on top of their game, optimization massage, needs to not be considered in the process of helping someone with back pain, because we're not optimizing anything when we've got back pain. We're trying to restore them back to normal. And that approach is very, very important. So when we're talking about the lower back, you might be tempted to get some lower back massage. Generally speaking, unless you feel comfortable in your practitioner's knowledge base around the lower back and what they're saying to you about that, I'd be a little bit more cautious about massaging the lower back. The one thing to bear in mind is when we're going to do that, we're going to get a reaction. Especially if there's a little bit of pressure through there, we're going to get a vasodilation reaction. You're going to shunt nutrition to that area, which is good for the muscles, but that excess circulation in an area that's already getting inflamed on a daily basis can potentially create some trouble. So if you are going to do that, although it runs contrary to likely what the masseuse will talk about, it may well be worth using a bit of ice straight afterwards to just make sure that although those muscles have been worked and we've got rid of some of the lactic acid from there, we've got a little bit of ice on that lower back to make sure that the inflammation locally in and around that disc, that 4-5-S1 region, can be calmed down immediately, so there's not that recurrent reaction. And maybe you do that a couple of times, 2 or 3, 4 times for 5 minutes, no more, subsequent to the massage, maybe later that day, a couple more times over the course of the afternoon, for example. But what else could you do to be a little bit more effective with massage? Well, we could start off with more gentle massage. Definitely there's no issue working on that buttock region, working down the legs and into the calves. We want to start off being a little bit more gentle, a little bit more soft. We want to remove some of those lactic acid, those waste products, and a lot of that is going to be that lymphatic drainage. We're going to be moved just by pressure through those muscles using, I haven't got it in the room here today, but the vibration gun that we've got is another example of that. It's just getting some manipulation, like wringing out a sponge gently. We're getting that exchange of nutrients in and out of those muscle tissues, so they're going to function a little bit more effectively. You'll all know at some point, whether more recently or in the past, we've been working out, we've maybe been on a run, or maybe we've been doing some sort of competitive sport, and the lactate builds up in those muscles and it causes them to spasm, go into cramp, dysfunction. Well, that on a low grade, a chronic grade, is going to interfere with the functioning of those muscles. And if those hamstrings, for example, or hip muscles are tight and restricted because they've got too much lactate in them, because they're constantly being bombarded and they're not able to function effectively, that is going to have a pulling effect on the lower back. So getting some gentle massage done to start with there wouldn't necessarily be the worst idea. It'll complement your stretching, and your stretching work will really be a little bit more effective if we're doing both of those at the same time. It will help. We can then slowly build up the intensity. Someone with back pain, we want to be a little bit more gentle to start with if we're doing massage-based work, see how they react to that first approach, and then we can potentially build up the intensity of work from there. But it must be done in conjunction with the principles that we outline in the Back in Shape process. The massage or the vibration gun that we use here is something that we use regularly, both on patients and on myself, and Lara uses it as well, to just keep those muscles healthy. And if we're doing the right sort of work, that can really complement the recovery process, especially when we're talking about back pain. So that's pretty much it from me on the topic of pain in the bum. And we'll go over to questions.
Okay, awesome. Good morning, everybody. Yes, please do pop your questions in the comments below, whether you're watching on YouTube or Facebook. I just had a really quick question on the topic of massage. Sometimes we'll go to masseuse and they'll do the whole sort of elbow in the glutes, trying to relax those off, some form of inhibition. What do you think about that? Do you think that's a good idea if you've got sort of sciatic type symptoms, or is it a bad idea?
I think that what we do in the clinic is, say for example, a patient comes in for their first appointment and we've got maybe x-rays we're going to do or whatever it may be. We always go with a conservative treatment. We always go with a bit more of a gentle treatment, and sometimes that's not Sometimes people, oh, you go harder, go harder, go harder. It's normally the guys that tend to say that, unfortunately. And harder isn't always better. And that first session that you have, maybe a slightly more gentle approach would be best. And if we're going to be doing any deep work, we want to do it maybe furthest away from the body to see how you react. Have those muscles in that posterior chain, maybe going from the buttocks all the way down to the calves, have they been working a little bit harder for a longer period of time? Because it's not necessarily that it's only the buttocks that's the problem here. That may be where the pain is, but all the other muscles maybe have been painlessly in a state of contracture. They're a little bit tighter than they otherwise should be, maybe than compared to the other side. So you can get a good gauge working in a safe region that how is this person going to react if we get a bit more of that deep work done on the calves, for example. Do they react quite quickly over the subsequent 24 hours? Then we know, okay, this patient's a little bit more volatile, things are a little bit more chronic than I'd initially anticipated, and really this is turning into a little bit more of a CPD course, so to speak, on our approach for other practitioners. But we work a little bit distally, further away from the lower back, and see how that patient responds over the subsequent sort of 24 hours. Do they get a lot of discomfort in the calf, a lot of reaction in the calf? Well, that's not necessarily a bad thing in of itself, but if that was in the hamstrings or the hips, then that might seriously limit their range of motion and therefore aggravate the lower back. It's not that the treatment itself, it's the reaction from the treatment is problematic, even though it's a necessary recovery step, and that's why we avoid those sorts of things ourselves, and we work a little bit more tactfully with the patient when we're doing stuff in the clinic. So we have to consider those things and how that person might react to treatment, which is why we start a bit further away.
Okay, Faye's asked a couple of questions
I'm not a big fan of doing that, but personally, just on a quick side note, to get a scale of what's happening when we are putting our whole body weight through the elbow, I've said this before, maybe not in a recent past. Get your elbow, grab a chicken breast, stick it on the kitchen counter, and dig your elbow into it with the same force, and look what happens to the chicken breast. We are getting a degree of tissue damage when we do that. So just understand that. It gives you a very clear visual on what's happening, because the chicken breast is muscle tissue.
Okay, awesome. So Faye has asked a couple of questions. Thanks for the explanation on massage. Would the massage therapist not recommend ice? And if not, do you know why not?
I generally, if I can speak, generally I think, I could be wrong here, but as a general rule of thumb, they're going to be recommending heat, because heat is going to help increase vascularization to the muscles, because they're about to do some work. So we all know, if we're going to go for a run, if we're going to do physical lifting, we should generally warm up. We should get blood flow to the muscles. So they would generally, I suspect, advise getting a bit of through flow and use heat afterwards, which is something that I'm not a massive fan of, as many of you know, who've joined us for many of the live streams. But they would probably generally recommend heat, because muscles like heat generally.
Okay, perfect.
And it's worth noting, and we tend to try and not confuse things by adding bits and pieces in. But if we've got a back issue, using a little bit of heat on the back of the hamstrings isn't necessarily a problem, because it's far enough away from the lumbar spine and this region here that it's not really going to create any issues. So it's worth bearing that in mind.
Okay, brilliant. Faye's also asked, is there a way of assessing ourselves whether we have a reduced lumbar curve?
Not really. I wish I could be more helpful. I'm really sorry with that. The problem is there's so many permutations, and a vast majority of practitioners aren't aware of these permutations, because they tend to not work with that degree of analysis on the imaging. And I know a few of you guys have come to the clinic, you've seen the analysis that we do. There are lots of different things that can. So, for example, just to do an actual example for you guys, so you can appreciate what I mean, because the way in which, so everyone is unique. Everyone has different muscle balance. We might have bigger glutes. We might have more or less fat lay down in certain areas, which creates the illusion over the skin that there is a greater or lesser curve. But there are certain issues that can arise that can create illusions. One of the big, most common ones is what's called a sway back posture, where the person, from a spine point of view, it should go something like that. And what happens is the person has what's called a hyperextension, where this one joint down here is actually hyperextended. It's a pivot point. It's very problematic. But the lumbar spine itself is actually flat, and this will create the illusion that there is actually too much curve, when in fact it is the lumbosacral junction, which technically the lumbar spine is finished at L5. L5S1 is hyperextended, bending backwards in a ridiculous fashion. Sometimes I've seen it, well, I have seen over 100%, so it's double the backward bending that it should have, but frequently you'll see 25-50%. increase at the one joint, which is a problem. It's generally a sign of some sort of trauma in the past, whiplash injuries, falling off bikes, backward bending. And I myself have had a problem like this, not to quite that scale, as a result, I think, of a trampolining accident doing backflips when I was about 14. So we won't get into that too much. But I know this situation very acutely, and the result of that in 2013 was that I had a pars fracture, stress fracture, which was not very pleasant. So a little bit about me there and trampolines. And I know there's one person in particular I can think of that might feel like she's not alone in that scenario. So just bear that in mind. But this scenario here is going to create the illusion that there's too much curve, and that is a problem. The other one we can get is that we've got a little bit of the bum sticking out too much, and then it's flat and straight, and that will create the illusion again that there's too much curve. So there's so many different ways in which the spine and these variations in the spine can be problematic, especially if we've got a more long-standing or difficult to deal with case of back pain. And the most important thing when we're a practitioner, or even when we're a patient, or you guys watching this with your back pain, is you need to know what you don't know or what you can't answer with current information. And one thing that is certain, you cannot effectively, reliably evaluate the status of someone's lumbar curve or pelvic tilt or the implications of that with physical examination alone. You need to look deeper in at the spine itself, and that is very, very, very clear in the thousands and thousands of x-rays and patient exams that I've done over the years.
Okay, brilliant. Jo has asked a question here. She said, I have a L4, L5 disc herniation, and even though it's improved, my back is always worse after I have a massage on the lower back. It definitely aggravates it.
The problem is a lot of the massage work is going to be pressing down when you're on your tummy. There may be some movement involved there as well, but are we doing heat afterwards? It may well just be that it's the mechanical movement that's been put through the back that's just a little bit too severe. It may well also be that there's that vascular reaction I mentioned earlier, where we're getting a shunt to that local area of heat, of blood flow, and that itself is going to aggravate the inflammation that's in the lower back, because we've already got the release of pro-inflammatory cytokines, which basically chemicals our body releases in an injury, to basically shunt more fluid there anyway. And we remember we've got between the discs and the segments, we've got a finite space here. We've got those bony boundaries, so it's not like the ankle whereby it can swell up and there's it's just going to stretch the skin. It's a problem. You see this in compartment syndrome in the lower leg, where it swells inside the fascia, and that's a serious problem. If that gets out of control. Yeah.
Okay, Rita's asked a question here. She said, I've damaged my right hamstring in the past, and I've had long-standing piriformis / glute pain as well. Since this fell out with my back, I'm aware of my right-sided weakness in my leg affecting my balance, and also when swimming, the right leg won't kick. Are there any strengthening exercises that might help?
I think the most general thing to start with is doing things like the lunges in phase 2 of the back, the lunges in phase 3 of the back in shape, the squats in phase 2, and some of those other exercises that are going to allow you to work symmetrically and sometimes asymmetrically to get a gauge. Work towards what I always personally do with weak sides is I always do the weak side first and train on that weak side. I think that's just the way I personally approach it. Rather than training to the strong side and just trying to catch up with the weak side, because sometimes you can overwork that weak side. The problem's going to be there is that the hamstrings provide such a stabilization role. They really help by fine-tuning the position of the knee and obviously the hip as well. And if they're gone a little bit, you're going to have your glute region, and it may also be your glute minimus and medius, which have a very proprioceptive balance-based role. They're also being overworked. Definitely on YouTube, and I think on the Facebook group, we put a little video of a proprioceptive exercise, the clock face exercise for the knee. And I think that's something that could really be helpful for you to compare and contrast both sides, and help build up some of that stabilization and control. Because as they get stronger and they get a greater degree of control, they'll start to overcompensate and compensate for maybe some of the weakness or the injury in the hamstring in the past, and that'll help things even out. Plus, we need to obviously deal with the lower back, because if they're injured from the past and then we've got a lower back injury, you've got a weak vulnerability that's being made worse by the fact that it's getting improper signals coming from this region down here in the lower back.
Okay. Brilliant. Hope that helps, Rita. Robin has asked on YouTube, I have an indent on my lower spine. It's quite a hole. What is this? I have an X-ray which stated a slight lack of lordosis in the spine.
So if you've had an X-ray, the one thing you'd think of might be a spondylolisthesis or spina bifida potentially, but that sounds highly unlikely. If you've had the images, you would know that. I really do think so. It's most likely, especially if it's in the center, it may well be that what I mentioned earlier, that particular example, that hyperextension, the one where I drew the triangle here and then the straight, that will create almost a drop, but it will also create a very pronounced bit of spine here. And that could potentially be what's going on there. It's not necessarily that it's a problem per se, it's just the way in which that structure is being pushed to the surface or pushed deeper by the alignment that is present in the lumbar spine. Really, that's the kind of thing that you'd need to have the X-ray there and then discuss with yourself. Actually, this is what's giving that illusion.
Well, if Robin, if that's kind of what we do. We've got the virtual consultations as an option. So if someone has an X-ray or an MRI that they want a second opinion on, they can always book in with yourself. And run through exactly what's going on. So that is always an option. I'd
also one final thing to bear in mind is we all do have little bits that are bumpy and a little bit different. And sometimes when we have an injury in an area. An injury maybe in the disc, for example, but we can't feel the disc. The disc is miles in there. You've got no chance. And anyone that says they can feel your disc is out, or they can feel your disc, I would generally say you need to ask them to implore them to clarify what they mean by that, because what it sounds like they mean and what they actually mean, I hope, are two worlds apart, and it's just them trying to explain to you that they can understand that there's something going on there. But if they genuinely mean I can feel your disc, then I would probably leave, because that's, they're either poking all the way through your bones to get to the disc, or they're not necessarily being entirely honest with what's going on. But what I was getting to there was that quite often, a lot of people, and it really commonly happens in the neck anyway, people will injure their neck and all of a sudden they'll start digging around an area that generally has never been touched really, and start to realise there's a lot of knobbly bits and pieces, and they get freaked out. And then we do an exercise, say, look, actually there's nothing here, it's just the fact that you're leaning forwards all the time and the neck bones stick out. So I wouldn't necessarily, it may be something that you're getting caught up on that's not necessarily a big issue, hopefully.
Yes. Actually, I feel like maybe we should do a video on the hump.
The hump in the back of the neck. That really bothers, especially a lot of ladies. It really bothers them.
And what you can do about it. Maybe we'll do that next week.
Yeah, if you find that interesting, then please do post it in the comments below, because that's a really it's
hot topic.
It is a hot topic, and there's a lot of stuff that can really put a lot of your minds at ease around that topic.
Awesome. Karen has asked here, why is nerve flossing so often recommended for these types of symptoms? Pass. I really don't know, to be completely honest. You've got a really delicate structure. The hypothesis there is that it's caught and trapped, and you think you want to just yank that structure, to loosen, free it up. I really don't understand why it's used. It's invariably used when you do it with a massively flexed position. I think it's I don't have a clue, is the honest answer. I really struggle to understand why on earth I'd ever choose to recommend that to anyone under any circumstances ever. And I never have, and unless I'm really missing the boat here, I never would at all. Yeah. Okay. Awesome.
It just goes against the fundamentals of everything we tell you guys.
Yeah. Absolutely. Faith just left a couple of comments. She said, good to know. I think I'll have to plan a trip to the clinic one day and get an X-ray. And also about the hump in the back, that I've got that on the back of my neck. So yeah, I do think that would be a good topic that we'll do probably next week. Yeah. Otherwise, I think we've answered everybody's questions for the day. Yes. Awesome. Thank you everybody for your questions.
Thanks so much for joining us, guys. Really appreciate it. Hopefully you found this one helpful, and hopefully it really made you maybe think twice about previous misdiagnoses you might have had. If you do find these videos helpful, then please do consider subscribing to the channel. If you're watching this on Facebook, then share it with someone that you know is struggling a little bit. Hopefully they can stop doing some of those mistakes, because they're all too frequent, which is why we've covered them today. With that being said, we'll be back tomorrow with another live stream. Have a great afternoon. Enjoy yourselves, and we will see you then. Thanks so much for joining us on today's video. Hopefully you found it packed full of useful information. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live so you can join us for our next live stream and Q&A.